For nothing is happening and all has gone wrong. It is here in this journey. You will learn to be strong. That concept of cancer happening to you, it's shattering, and then all of these questions come to you that why me? I think only self-belief, only faith in ourselves can help us overcome something like that.
Good morning. I'm Dr. Tehreem Sayyed, the Director of Rising India Research Foundation and Head of Center for Psycho-Oncology. To begin with, Rising India Research Foundation was founded in the year 2014 by Dr. Girish Lad. Recognizing the profound impact of cancer on mental well-being, Rising India Research Foundation initiated the Center for Psycho-Oncology, which focuses on the emotional and psychological needs of cancer patients and their families, bridging the gap between medical and psychological care. It's an absolute honor to have Mansi with us. She's an amazing person who has beaten non-Hodgkin's lymphoma at the age of 23. She's also a practicing graphologist and a psychology postgraduate student. Mansi's journey shows the incredible strength that individual with cancer possesses. We are thrilled to have her here today to share her experiences, insights, and wisdom with all of us. Mansi, welcome to the Center for Psycho-Oncology. Your presence is an inspiration, and we are eager to hear your story and how it sheds light on the vital relationship between cancer and mental health. Thank you once again for joining us today.
Thank you so much for having me here, Dr. Tehreem, and I'm truly honored to be here, and just thank you for having me.
Let's begin by understanding a bit about your journey. Could you share when and how you were diagnosed with non-Hodgkin's lymphoma?
So I was diagnosed with blood cancer, non-Hodgkin lymphoma, on 21st Feb to be very specific. But we have to go back a little to understand how I landed there. So first week of December, I go through immense leg pain, and then I cannot walk like for 1 week straight. Then we visit some doctors, and then they prescribe medicines and physiotherapy goes on. So I feel better for a month, and then again that pain starts emerging. I think by mid-Jan, we started realizing that this is something serious and we have to visit an orthopedic hospital. So there we went through a lot of tests. First X-ray, MRI, then it reached to the point of PET scan, and then we also went through biopsy. So all of these procedures, and then I think after BMT, we figured that it's a blood cancer.
So that must be a very challenging moment for you, Mansi, and equally for your family too. So Mansi, can you shed some light on how the news was broken to you, and what was your initial response?
So my doctor broke the news to me, and he told me that I have been diagnosed with blood cancer. My initial response, it was such a shock. It came off as such a shock. So I just can't recall all the questions in my head and what was the interaction like. But it was all very shocking. And in that room, I realized my life changing. I could picture myself in all the different scenarios. And I think it was that the concept of cancer happening to you, it's shattering, and then all of these questions come to you that why me? And it's just disturbing to know that you have cancer. I was there, I came to hospital thinking that it's a blood infection, but cancer, and that too very abruptly. It was a disturbing news, and for a few hours I didn't know how to understand the gravity of that word and what my life will be like. I didn't know that, so I had no idea how to handle myself at that time.
We can imagine how overwhelming that must have been for you. And to our viewers, non-Hodgkin's lymphoma is a type of blood cancer that originates in the lymphatic system, which is a crucial part of body's immune system, and it affects lymph nodes, lymphatic vessels, and even organs like spleen and bone marrow. And there are various subtypes, each with its own characteristics and treatment options. So Mansi, were you given any counseling support after breaking the news?
Not really. They did suggest a counselor, but here's when me being from the background of graphology, and I've also been studying psychology. I know how important it is to have a counseling or even a psychological support for that matter. And I asked for it. I did mention that I would like to get counseling sessions. But my experience overall with that was the counselors were not thoroughly aware of what thoughts do oncology patients have, and I was not guided that way. I feel there's a huge gap between this oncology treatment and then psychological treatment for oncology patients. So I think that was missing, and I felt that gap there. That if I could have a better counseling support or a better psychological support, I would have handled it in the initial stages. I would have handled it much better. So I think that gap was something I felt at that moment, and I'm actually very glad to be here today because you yourself, like your center, talks all about providing counseling services to cancer patients, and yeah, that's just wonderful.
Yeah, absolutely. And as we all know that the cancer is accompanied by a lot of uncertainties. There's a lot of fear, not only for the patient who's suffering, but also for the family members. Like there's a lot of emotional turmoil, and somewhere that need for counseling is not only required for the individual who's suffering, but also the family members, like showing that to the like your mom showing herself strong in front of
Correct,
you,
absolutely.
and you also somewhere like, okay, I do not have to break down. Yeah.
So I think what you're saying is absolutely correct because no matter how hard these our parents try or our caregivers try, they are facing issues from a lot of areas. Like I personally, I had to look forward and like be okay for the treatment, but they had a lot of different responsibilities, and I think counseling for them is equally important. Or that grief will be stored, and then you don't know how that is expressed later. So I think that is something. Very crucial because not just the patients but caregivers should require counseling just like as much as we do.
Yes, absolutely, and that's the reason we at Rising India Research Foundation, which is also the world's first independent center for psycho-oncology, and we are focusing on patient-centric counseling support, and which will focus more on the emotional well-being. And we are also providing supports like pre and post-diagnostic counseling, individual and group therapies, onco-rehabilitation, psychometric assessments. So here we will not only be catering to individuals, but also we will be catering to family members, caregivers, and also the healthcare professionals.
Absolutely.
Because they too go through a lot of burnout and compassion fatigue. And we are also collaborating with various institutions who are working in the field of cancer.
That is wonderful.
So coming back to you, Mansi, can you tell how the diagnosis changed things for you? Your outlook towards life, your priorities, your future plans?
Okay, so I think the diagnosis and the treatment, both, they change something both positively and negatively. And to begin with, I think even though it took a lot from me, like when it comes to my body, my physical health, and even my mental health, it also gave me new perspectives. So when I say about my priorities or my outlook towards life, I think I've become much more clear. I've attained a lot of clarity, and while reflecting on certain aspects of life, I realized that this is something I just can't sit here and say that life is unfair. This is something it's been thrown at me, so now it's on me how I'm what I make of it. So that's that optimism, that's that attitude that really helped me with it. And also I got a lot of clarity regarding my purpose in life. I've always been very passionate regarding graphology, and I've also been enthusiast when it comes to psychology. But while these 6 months, in like 6 to 8 months, I realized that this is something I really want to do for the rest of my life, and I felt very empowered, and all the things that I did when it came to graphology, it made sense to me. It was really a meaningful thing. So this is how it changed my attitude towards my career, and that's something that gave me purpose. So yeah, and I also feel like I got a little bit calmer, and emotionally I think मेरा resilience काफी बढ़ा है, I feel, with this treatment and everything. I never thought I had it in to overcome something like that. And once you are thrown in this situation, you have no other option. And then you think of doing it, with a smile on your face, with a little bit of grace, and with a pinch of patience and optimism. So I think that really that was my perspective altogether towards cancer and this treatment.
Wow, it's really inspiring that despite being so young, you were able to find strength in moments like this. Can you also tell me something about the support system? Like how did your friends, your family, they react, and how they supported you in this difficult time?
So my family, my parents, I think I'm eternally grateful to them. What they've done for me, it sounds cliche for me to say this, but I think I can truly never begin to comprehend what their thoughts might be at that point of time. I might have felt something on a level of 80. I think they were going through 110. So that's how difficult it might have been for them. And still, keeping up with me, my mood swings, my tantrums, and then supporting me with all this, supporting me in all this, and just being there for me. And then my relatives, family, friends. I think they've brought so much motivation and positivity to me. I think they are the beam of light, in my life. And when it comes to my friends and also my brother, my younger brother, so like I think they are a bunch of sweetest human beings. And whatever they've done for me, I think they understood me a lot in this phase of my life, and I got a lot of motivation and positivity from them. So it was really cute, and their letters, their small messages to me. Some of them used to send songs and like write something to me, and it was always good to read that. It kept me going. So I think my family, support system, friends, everyone, they played a huge role in getting me through this phase. Yeah, I think I wouldn't have survived what I did without them.
Yeah, definitely. Like support system plays a very important role in our life. Like without support, I think it would have become very difficult.
Yeah.
Right.
Right.
And acceptance that plays a very important key role and in the process of healing.
Right.
And Mansi, like you accepting the situation and being there and not giving up is such a brave step that you have taken.
Thank you so much. And I think about acceptance, the thing is, there's this acknowledgement of the disease. It takes a lot of time. I'm just saying it very casually, but it takes a lot of time. But once you do that, you start building coping mechanisms. You start, looking at all of this in a very different light. You start to look at it as a new opportunity to create a new normal for yourself. So I think acceptance really played a huge role, and had that impact on me where it gave me a perspective of looking at things in a very different light. So very well said about the acceptance part.
Right. And definitely you have also adopted healthy and positive coping mechanisms and strategies. So that also plays a very important role. Like,
Absolutely, absolutely.
so cancer treatments can be incredibly challenging, like from the anxious moments in the waiting room, and I'm sure you might have spent a lot of time in the waiting room, to the rigorous radiations and chemotherapy sessions that might have become part and parcel of your life during that moment. Like, so as a young person, we are eager to hear from you, like which were the most toughest moment you encountered during the treatment and strategies you employed to overcome them.
So the most difficult part of the whole treatment was chemotherapy. Whoever was gone through chemotherapy very well knows that there's lack of appetite. You feel nauseated all the time. So there's nothing you can do about it, and you are physically exhausted, and then mentally all those negative thoughts start circling in your head, and you don't know how to deal with that because you are physically unable to do anything else as well. Here's when I introduced a little bit of reading. I always liked reading, but here's in the hospital, I focused more on like books like Tuesdays with Molly. So they really inspired me to go through this, push it through. So that's something that was one of my coping strategies when it comes to chemotherapy. And while in radiation, when you talked about waiting rooms and all of that, I've done my share of waiting in that radiation aspect. So whenever I used to go for my radiation therapy sessions, so I used to wait for 2 hours, 1 to 2 hours was like minimum amount of time I had to wait. So later that word got out that I'm a graphologist. So they, like one of the person approached me and then they said that we would like to get our handwriting analysis done. So I did that for them. I always love handwriting. I always love analyzing handwriting. So I did that. And then the next day, 2 more people came in and they wanted to get the handwriting analysis done. And then the third day, more people. So that's how I think the later part of my radiation sessions was spent. Like I don't think I waited there in the later parts, and I was utilizing my time analyzing handwritings. I think it was a give and take because I analyzed their handwritings, awareness, gave them a little bit of awareness about themselves, and they helped me pass through my radiation therapies smoothly. So it was an interesting experience.
So after listening to you, Mansi, I'm just waiting eagerly when the session gets over and I will have my handwriting analyzed by you.
100%.
So Mansi, did the knowledge of psychology help you to build resilience in your journey? And how did your hobbies and interests help you to cope with these uncertain times?
I think awareness was a huge part of psychology and graphology. As a graphologist, I've always, worked towards making people aware about themselves. So naturally, I had awareness about myself. I had awareness of my coping mechanisms, how I respond in situations like these. So I knew somewhat how to handle myself better. It was an easier, journey that way because I had a psychological background and graphology background. About hobbies, I think. I involved myself too much in reading, and painting was a huge part of me. While I used to feel like whenever I used to feel frustrated, I used to paint and like draw a little bit. That used to really ease off the frustrations. Also, I've watched a lot of content, like psychology-related content, in that in those 6 months in that phase of my life. So these were pretty much what I used to, how I used to spend my days apart from when I was in the hospital. And I think here's when psychology really played a part.
Yeah. So I must say, Mansi, like how beautifully you utilized the time and you coped with the situation. Yeah. So can you recall a memorable moment or an interaction with a healthcare professional that has a lasting impact on you?
So my doctor, Mr. Samir Milankeri sir, so he was guiding me throughout this whole treatment and all of that. So he used to come up every morning while my chemotherapy session. So every morning he used to come up and check on me. So in that 5 minutes of conversation or interaction, he just used to bring a lot of casualness, and that used to ease me. A little conversation about the book I'm reading, or just telling me, no, you're all fine and you don't have to worry about anything. Very affirmative and very casual way. So I think that was something I used to look forward to. If he came and talked to me, my whole day used to be okay. That's fine. I'm going to be okay. I had such faith in him, and that's just his aura, the way he, the space he created between us. It was very comfortable, and I felt very, very secure, very, very safe. And I had a lot of faith in him. And yeah, I think that's one of the most impactful person while the treatment. And I think our interactions used to have a major role in making me feel better.
So I think the safe space and the non-judgmental attitude by your doctor really helped you in this journey. So as a psychology student yourself, how relevant do you think mental well-being is in cancer journey?
I feel like we talk a lot about cancer patients being positive, and that helps their treatment eventually. But I personally felt it when I went through it. I feel like if I had, a positive outlook towards my treatment at that day or that time of the day, I used to accept that treatment better. So that is something, very serious. Like that is something. If my mental health is directly affecting how I accept the treatment, that definitely means that mental health and being positive and being okay and accepting about the treatment really helps, and that helps with you getting better. So even as a psychology student, now when I look at it from that perspective, I already was very well aware that counseling and then having a stable mental health is really important when you have to deal with any situation for that matter, and that really played a huge role here. But I also felt like there was a lack of psycho-oncologists, people who are specifically trained to deal with oncology patients, cancer patients, and their mental health. So I felt the gap there. While I was going through all of this, I studied, and me being from psychology background, I still didn't know about the psycho-oncology field. And because I went through this, I realized, this is really crucial. People training and getting educated here in this aspect is really, really important. And I congratulate, because you educate people, and then you also counsel caregivers as well as the patients. So that's something very wonderful, and I'm really honored to be here because that's something I truly believe in. That is the cause I truly believe in.
Thank you, and I'm really glad like you recognize the need for mental health in cancer journey. So as we all know, like cancer is the second leading cause of death globally, and in India we see 1 in 9 people are at the risk of developing cancer. So cancer is not only affecting the individual who is suffering, but also the family members, as we talked about it earlier. So, like for every one individual who is suffering, there are 4 members who are staying with the person is affected. And the number of psychologists, if you see in India, are very, very few. And they're not even reaching a 3-digit figure. So that's how we felt the need that there is a need for psycho-oncology, and that's how the center started. And our partner organization, that is Texas School of Mental Health, in collaboration with IIT Hyderabad, is launching a PG diploma course in psycho-oncology. So we are shortly, it will be started, and this is specially designed for those who want to work in this field, so that a change that we are looking forward to. So before we wrap up, what advice would you like to give to others, especially young individuals who may be facing a similar diagnosis or a difficult health challenge in their life?
So at the beginning of the treatment, I really had those thoughts that how can I do that? How can I overcome something like this? It was thrown at me, right? And then I had no time to prepare and everything. But what really kept me going was faith in myself. It sounds very cliche, believe in yourself, but it is really important. Never underestimating your strength, never underestimating what you can do for yourself, how you can over a certain issue. That is something you have to believe in. You have to believe in yourself. You have to believe that that is something you can do, and that's exactly how it's done. And I think, moreover, it's not just for cancer patients I'm saying this, or people suffering with any health-related issue. I'm also talking about people facing any adversity in their life, any issue in their life, and they feel like we all have that self-doubt in ourselves, and we all feel like maybe I'm not good enough, or maybe I can't do this, maybe I can cross that, maybe I can't overcome, and all of these are like barriers in our heads. I think only self-belief, only faith in ourselves can help us overcome something like that. So I think my advice will be twofold here, because I would definitely say that never underestimate yourself, believe in your strength, believe in your capabilities, and also have a purpose. Have a purpose in your life, because that is something that's going to drive you towards overcoming any sort of issue, any sort of adversity. And that's something that worked for me personally. Me going through this, one of the most important things that made me go through all of this was I want to do this because I have a purpose right in front of me. I want to be able to practice that. I want to be able to practice graphology, learn more about psychology, and help people overcome their mental health related issues. So that's something that was my purpose, and that drove me a lot to overcome this. So have faith in yourself. It doesn't sound, it sounds easy right now, like the way I'm saying it, but it happens gradually. You have to start, believing in yourself. There are certain activities that you can do, and it all begins with self-awareness. That, and then have a purpose, have a purpose in your life. That is what, overcoming any issue, all of that is meaningful only when you have a purpose. So I think that's the advice I'd like to give.
Wise words indeed. Like having purpose in our life is so very much important. So thank you so much, Mansi, for sharing your incredible story of resilience with us today. Your strength is an inspiration for all of us.
Thank you so much. Thank you, Dr. Dhareen, and thank you for having me here. I feel, it's a very personal story, and sharing this, I was a bit hesitant, to be honest. But I felt like even, a fraction, even if it adds, to someone, even 1% of people, I think my mission here is accomplished. And I feel that my purpose here is, going somewhere. My whole idea of coming here and talking about, all of this, my journey, my treatment, because I know there are a lot of people that go through same situations. If that gives inspiration or even helps in any way, I'll be really happy and really grateful. And I'll feel blessed. Lastly, I'd like to sum it all up with just a few lines. For the highs and lows and moments between, mountains and valleys and rivers and streams, for where you are now and where you will go. For I've always known and I told you so. For nothing is happening and all has gone wrong. It is here in this journey you will learn to be strong. You will get where you're going, landing where you belong.
Thank you, Mansi, and that's like, it will definitely help people who are suffering from cancer. Your story will be a motivating factor for them.
Thank you.
And to our viewers, if you or someone you know is dealing with a health challenge, remember that there is hope and you do not have to fight it alone. So reach out to your healthcare professionals and loved ones. And additionally, don't hesitate to contact Rising India Research Foundation. For someone if you know is dealing with cancer, we are here to support you. We are there in your journey. So reach out to us at support at risingindia.net.